So we're a couple of visits in. How are you doing today?
I'm feeling great. This is my best week so far.
Okay.
Only up from here.
All right, good. Hello everybody, Dr. Dave here with Synergy Wellness, Chiropractic and Physical Therapy in New York City. We got Simon here, who had, I guess your original injury was playing football, right?
Yes, indeed. Yes, indeed.
So as you can see, he's a big guy. I'm 6 foot. He's bigger than me, so I'm actually 6'1". But he plays in a flag football league, and it gets rough, right?
It does.
You guys are tackling each other.
There's a lot of pushing to the floor, banging, rough touch. Yes, it's pretty rough. Yeah.
So it's rough flag. Okay. So he originally had a hamstring injury, right?
Right.
A while back, and just re-injured his back playing football, and we're just getting him back in shape. So go ahead, take your glasses off and lay on your stomach. So we're a couple of visits in. How are you doing today?
I'm feeling great. This is my best week so far.
Okay.
Only up from here.
All right, good. Chin at the bottom of the paper there. Yeah. Good. Let's see if they're... So look at the flexibility here in his quads. You'll notice they're both tight, but this left one is tighter. You can see how this right leg bends further. I have to force this left one to bend evenly. Do you notice how your left quad is tighter here?
Yeah, for sure.
So, yeah, just to even them out like that, I have to kind of force that left leg to bend more. So I can tell his pelvis is pulled back a little bit on this side. It's not bothering him. He said he has no pain, but we want to correct this before it does start to bother him. Okay, I'm gonna have you lay on your right side, so face me right over here. Okay, now we're gonna do some ART on his glute and multifidus. All right, so what you're gonna do is you're gonna bend your knee slightly, just about a 10-degree bend, and with your toes, you're gonna touch the corner of the wall, slightly down from where I touched, a little bit down there.
My left leg?
Yep. Yeah, there you go, and bring it back against my leg here. Yep, and again. Yeah, and you're going to brace yourself on the table here.
Gotcha.
Good. Yep. Yeah, this is active release technique. Good. How you doing there, okay?
Yeah, I'm good.
Sore, right?
Yeah, feels good though. Getting an ab workout too. This is nice.
Yeah. Good. Now we're going to do the other side. Okay, now brace yourself with this hand. Go ahead. Yep. Bring your leg all the way back. Good. Good. It's hard to do. Once you get like 10, it gets tiring.
It does. Faster than I thought.
We'll give you a little break here. A couple more reps.
All right.
Yeah. Good. And one more. Good. All right. Lay on your stomach. Now, obviously that's not going to change. All we did was release his glutes. So the glutes are not going to change this. This is because of pelvic misalignment. And yes, that can be triggered by a glute, but loosening up the glute is not going to pull his pelvis forward again in the right position. We have to actually manually manipulate or manually adjust his left pelvis. So we're going to have you come with the left side up. So again, on your side facing me. Good. Bend this top leg. Are you playing football tomorrow?
No.
It's going to be beautiful weather too.
I know.
Slide forward a little bit. Is your season over or just getting started?
It's kind of, yeah, it's over, but we're starting a new one in September.
September.
A couple weeks to get ready.
Alright, so when done right, even a small chiropractor can adjust a big guy like this. I don't have any problems, but you know, sometimes guys are really stiff. Big guys like himself are really stiff. He's moderately stiff. He's not as bad as he was a few weeks ago. And just relax yourself here. And the best thing the patient can do is just relax. Deep breath in. Good. And blow all the way out and just relax here. Good. And the other side up. And bend the top leg. And all right, slide your pelvis forward a little bit for me. Good. And take a deep breath in. And blow all the way out. Good. And now lay on your stomach. So let's see how he took to that adjustment. Check it now again. Look at that. I'm not doing anything different. Do you feel any more tension in your left quad versus your right now?
Feels pretty even.
Yeah. So both legs you can see here are bending evenly. Before it was like this, okay? And I had to force this left leg to bend further. Now I don't have to do that. They're both going even. The pelvis is now balanced. But his lower back is in a little bit of hyperextension facet syndrome like you see here. So he suffers a little bit from that. And that can come from having weak abdominals. Do you strengthen your abdominals at all?
Not as much as I should.
Okay. So it's common to see facet syndrome when people are, when they have a weak abdominal, weak core, or weak hamstrings. Okay, keep your legs straight without bending your knee. Raise one leg as high as you can.
Which leg?
Either one. Okay, and down. And the other one. Okay, good. How does that feel?
Oh, it feels pretty good.
Okay. Both legs were going up evenly, so what I was checking for there was a rotated sacrum. Sacrum bone is right down here. Okay, now we're going to be able to bend these knees even further without any pressure on your lower back. How's that feel?
Feels good.
I know you were feeling good when you came in here. You said it was your best week yet, right?
Yep.
So just these small little corrections could be really helpful to ward off any more serious problems. A little bit sensitive right in there too, right?
Yeah.
Okay. Go ahead, take a deep breath in. And blow all the way out. Good. Turn over on your back. front of you. Tuck your chin down, deep breath in. Go all the way out. And one good. Oh yeah. Alright, hands up in the air. Do a Y strap adjustment. And head up. Drop your head back. Growing out the ZZ Top beard.
Yeah.
Alright. Gently lift your head, drop it back. Any headaches at all?
No.
Good.
That's hurtful.
And relax yourself here. Hands up in the air. So, unfortunately, he's a Patriots fan. But you know, we treat all fans, all football fans. A little extra TLC for the Giants fans, of course. But I'm not going to hold it against him that he's a Pats fan. Especially moving forward. I don't know. We'll see how good they are, but you're all set, champ. All right?
Appreciate
I can call you champ for now.
Yes, you can. Anytime.
We'll see though in a couple years. We'll see how that dynasty is going.
Gotta stay positive.
Without Tom Brady.
Gotta stay positive.
Thanks for tubing in.